Hello, welcome to this video, which is about simulation-based medical education. My name is Muhammad Hassan Taha. I am the director of the Medical Education Center at University of Sharjah and the coordinator of the Master of Leadership in Health Professional Education and PhD in Health Professional Education. These videos are related to instructional methods in Health Professional Education course and teaching and learning course. In the previous videos, we talk about effective lecturing and team-based learning. In this video, we'll talk about simulation-based education in health professional education. Today, we will cover the following. Why simulation exists, what simulation actually is, the science behind simulation, the types and tool. Then we'll talk about briefing, debriefing, which we consider the heart of all, patient safety evidence, and the future of simulation in health professional education. Let us start the video by talking about why simulation. What is the rationale behind introducing simulation in health professional education? And to talk about this, let us ask this question. Would you let a pilot fly passengers without simulation training? The answer definitely is no. So then, why do we do it in medicine? There are three forces that broke the old model in health professional education, which training medical students in patient. One of the things is patient safety crisis. Medical errors are reported the third leading cause of death in the United States of America. They studied in 1999. Moreover, there is a shrinking access, fewer patient beds, shorter hospital stay, or patients sometimes refuse to be trained on. The other force supporting the use of simulation is the competency demand. So evidence alone isn't enough. You must be able to do it, not just to know it. And in order to have adequate time for doing it and developing competencies, you cannot do this in patient with your students. So this is a rationale also behind simulation. So in aviation sector, no commercial flight without extensive simulator hours. Emergency rehearse thousands of times before they happen for a real life. And crew resource management training simulation. Why? Error in simulation mean equal learning, but errors in real life mean disaster or equal to disaster. The situation in medicine till recently is to learn on real patient and to handle emergency for the first time in real emergency. And communication skills learned by trial and error. And the ultimate issue here, errors equal harm to actual patient. So with the concept that error in simulation equal learning because students will learn from their error, here in real life in medicine, error equal harm to actual patient. Now, we talk about the rationale behind simulation. Now let us talk about simulation and define simulation in health profession education. So what is the simulation? The key message here, simulation is the methodology, not about machine, not about mannequin. And the conceptual definition of simulation, it is a technique to replace or amplify real experience with guided experience that evoke or replicate substantial aspect of real world. So it is a technique. It's about how you teach. It's not about what equipment you use. Unfortunately, in practice, the focus on the equipments and high fidelity, functional fidelity, and in practice, people reflect the essence of simulation, which is about the technique and how you teach. Why? Because a role play with a colleague is called simulation or considered as simulation. This is very important thing to be considered. Now, let us see this conceptual definition, just we talk about it, to replace or amplify real experience with guided experience that evoke or replicate substantial aspect of the real world, and the focus on the methods and technique, not on technology or the equipment. This is a key message. And also let us see the operational definition of simulation, which is about the creation of an event, situation, or environment that closely mirrors what one would encounter in real practice. And this operational definition of simulation highlights the importance of focus on environment and context, and emphasizing the ecological and situational fidelity. And both definitions, the conceptual one and the operational one, they are complementing each other. The conceptual definition always reminds us that a low-cost role play could be considered a simulation because it is a technique, it is the methods. And if it provokes guided learning. And the operational definitions remind us with the importance of the environment. And the environment here should be designed in a way that mirror clinical reality, because the main aim of simulation is to create an authentic learning environment. This is a very important thing that need to be considered. There are important four hats for simulation in health professional education. The first hat is teaching, assessment, quality improvement, and patient safety. In simulation, we practice skill safely before patient contact. Simulation gives us opportunity to standardize OSCE and to standardize competency verifications and to build entrustment, which is related to entrustment professional activities, ABAs. And through simulation, we can test new protocols before going live. And also in simulation, we can advance patient safety because error, it helps us to obtain error prevention, and it helps us to train team training in a good way. Now, let us talk about the four classifications or four types of simulation. Number one, low fidelity simulation, mid fidelity simulation, high fidelity simulation, and functional fidelity simulation. The low fidelity simulation also called task trainer. This is simply like IV cannula, the catheter, and the static model in which we train suturing and so on. And it is very useful to be used for one skill for the blade practice. For example, measuring the blood pressure using the IV cannula, and with it's high, we can do high repetition with low cognitive load. The mid-fidelity simulation, which also called bar task mannequins, it is a machine, we can program it, like programming mannequins with the heart sounds, with the breath sounds, basic vital signs. And in this kind of part task mannequins or mid-fidelity, there is no facial expression. There is no interaction. So it bridges between task and team training. The high fidelity one, which is full body mannequins, it is a mannequins with computer control. These mannequins with computer control, they can breathe, they can blink, they can even speak, they can deteriorate in emergency, and this could be used in training such as ACLS, critical care, emergency. But the issue here, this kind of high fidelity simulators, most expensive, and it needs simulation techniques, technologists, trainers, and so on. The highest level is the functional fidelity one, is simulated patients. And simulated patients, we train people in simulations because simulated patients are more authentic, because training in patients that are trained, not necessarily to be real patient, can be trained, and it is psychological and behavioral realism, not physical, and essential for communication, maybe such as breaking bad news or when we want to examine, showing empathy. And these more powerful than mannequins for clinical reasonings, because students can talk to human and they are trained very well with that. So these are the classification of the simulation. Let us now understand the science of the simulation, and the science of the simulations will be the next video of this series.